So, intermediate extrinsic muscle group include two muscles. This is a serratus group, including serratus posterior superior and serratus posterior inferior. Now, there are intrinsic back muscles are there. Intrinsic back muscles include iliocostalis muscle, longissimus muscle and spinalis muscle. There are intrinsic back muscles are iliocostalis, longissimus, spinalis, semispinalis and multifidus muscles are there. So, back muscles can be divided into three groups. The back muscles have been arranged into three groups. These are the superficial extrinsic group, intermediate extrinsic group and deep intrinsic group. So, superficial are trapezius, latissimus dorsi, levator scapula, rhomboidus major, rhomboidus minor. I have to बंद कर लीजिए. Now, the back muscles have been divided into three different groups: a superficial extrinsic group of muscle, intermediate extrinsic and intrinsic back muscles. Superficial group includes the trapezius, latissimus dorsi, levator scapula, rhomboidus major and rhomboidus minor. So, we will go through the origin, insertion, and regarding the trapezius. Trapezius is origin from the medial 1/3 of the superior nuchal line, external occipital protuberance, ligamentum nuchae, spinous processes of the vertebra C7 to T12. Now, it is inserted to the lateral 1/3 of the clavicle, acromion process and spine of the scapula. Now, its action of the trapezius include elevation and depression of the scapula depending upon which part of the muscle contracts, and it rotates the scapula superiorly and retract the scapula. It is innervated by two innervation, that is spinal accessory nerve and proprioceptive innervation from C3 to C4. Next muscle is the next superficial extrinsic muscle is the latissimus dorsi. Latissimus dorsi origin from vertebral spines from T7 to the sacrum, and T7 to the sacrum, posterior 1/3 of the iliac crest, lower 3 to 4 ribs and inferior angle of the scapula. So, latissimus dorsi origin from the vertebral spine from T7 to sacrum, posterior 1/3 of the iliac crest, lower 3 or 4 ribs, inferior angle of the scapula, and is inserted at the floor of the intertubercular groove. Its action is extend the arm and rotate the arm medially. Innervation is thoracodorsal nerve from the posterior cord of the brachial plexus. Next muscle is the next superficial muscle is the levator scapulae. Its origin is from the transverse process of the C1 to C4 vertebra and inserted into the medial border of the scapula from the superior angle of the spine. Its action is elevation of the scapula and is innervated by dorsal scapular nerve, and upper part of the muscle receive branches from C3 and C4. Next muscle of the superficial extrinsic group is the rhomboidus major. Its origin from the spinous of the vertebrae T2 to T5 and is inserted to the medial border of the scapula inferior to the spine of the scapula. Its action is retracts, elevates and rotates the scapula, which depresses the glenoid fossa. So, its action is retraction, elevation and rotation of the scapula is the action of the rhomboidus major muscle. So, innervation is done by dorsal scapular nerve. Next muscle of the superficial extrinsic group is the rhomboidus minor. Rhomboidus minor originates from the inferior end of the ligamentum nuchae, spines of the vertebra C7 to T12. It is inserted to the medial border of the scapula at the root of the spine of the scapula, that is rhomboidus major. Rhomboidus major does retraction, elevation and rotation of the scapula, and which depresses the glenoid fossa and innervated by dorsal scapular nerve. So, these were the muscles of the superficial extrinsic group. Next muscle group is the intermediate extrinsic muscle groups. This intermediate extrinsic muscle group includes the serratus posterior group. It includes the serratus posterior superior and serratus posterior inferior. So, for the first muscle is in the intermediate group is the serratus posterior superior. Serratus posterior superior originate from the ligamentum nuchae and spines of the vertebra C7 and T1 and T1 to T3, and is inserted to the ribs from 2nd to 5th ribs and lateral angles to the ribs. So, its origin from the serratus posterior superior originate from the ligamentum nuchae and spines of the vertebra C7 and to T1 and to T3, and is inserted to the ribs, that is 2nd to 5th ribs and lateral to the angles of the ribs. And its action of the serratus posterior superior is elevation of the upper ribs, and is innervated by branches of the ventral primary rami of the spinal nerve T1 to T4. Next muscle of the intermediate muscle group is the serratus posterior inferior. It originates from the thoracolumbar fascia and from the spines of the vertebra T11, T12, L1 and L2, and inserted to the ribs 9 to 12, and it's from the lateral angles of the ribs 9 to 12 ribs. So, its action is it pulls down the lower ribs and it's innervated by branches of the ventral rami of the spinal nerve T9 to T12. Next muscle is the iliocostalis. These are intrinsic muscles. The next group of muscles are the intrinsic group of muscles. So, intrinsic muscle groups includes iliocostalis, longissimus, spinalis, semispinalis and multifidus. The first muscle is the iliocostalis. It's iliocostalis, and it's originate from the iliac crest of the sacrum and inserted into the angle of the ribs. Its action of the iliocostalis is it extend and laterally bend the trunk and neck, and it's innervated by dorsal primary rami of the spinal nerve C4 to S5. Other muscles are longissimus, spinalis, semispinalis and multifidus. Another muscle is the erector spinae. Another intrinsic muscle is the erector spinae. Its main function is the extension of the trunk. This is one of the extensor of the trunk. So, this erector spinae is having two parts, longissimus thoracis group and iliocostalis muscle group. Now, it can be divided into superficial and deep layers. Longissimus thoracis, pars thoracis and iliocostalis pars thoracis are the superficial erector spinae group, and iliocostalis pars lumborum and longissimus thoracis pars lumborum are the deep muscle group. So, erector spinae muscles are the extensors of the trunk. Next muscle group is the multifidus muscle group. Multifidus muscle group consists of a number of fleshy tendinous fascicles which fills up the groove on either side of the spinous process of the vertebrae from sacrum to the axis. So, multifidus is a number of fleshy tendinous fascicles and which fills groove on the either side of the spinous processes of the vertebra from sacrum to the axis. So, we were discussing about the muscles of the back region. So, we divided the muscles of the back region was divided into superficial extrinsic muscle group, which include the trapezius, latissimus dorsi, levator scapula, rhomboides major, rhomboides minor, and an intermediate extrinsic muscle group which include the serratus posterior superior and serratus posterior inferior. And there is another muscle group called intrinsic back muscle group, that is the most deep muscles. It includes iliocostalis, longissimus, spinalis, semispinalis and multifidus muscle. Next muscle, next we will be discussing about the lower limb muscles right now. We will be starting with the muscles of the buttocks. The first muscle on the posterior region of the buttock is the gluteus maximus. This is the largest and most superficial muscles among the gluteal muscle group, and it makes a large portion of the shape and appearance of the buttocks. Now, gluteus muscle, gluteus maximus, first we were discussing about the gluteus maximus muscle, which is the largest and most superficial muscle of the gluteus muscle group, and the gluteus maximus origin from the gluteal surface of the ilium, lumbar fascia, sacrum and sacrotuberous ligament, and it is come down and inserted into the gluteal tuberosity of the femur and iliotibial band or iliotibial tract. Now, the action of the gluteus maximus is external rotation and extension of the hip joint. It supports the extended knee through IT band, and it is one of the chief anti-gravity muscle during sitting. So, its action, it is a posterior muscles of the buttocks, and its main function is the extension and external rotation of the hip joint, and it supports the extended knee through the IT band, and it is one of the chief anti-gravity muscle, especially in sitting posture. So, and the nerve supply is from the inferior gluteal nerve. Next muscle of the gluteal region is the gluteus medius, and its origin from the gluteal surface of the ilium, and it is situated under the gluteus maximus muscle, and is inserted to the greater trochanter of the femur. Nerve supply is from the superior gluteal nerve, that is from the L4, L5 and S1 nerve roots. The function of the gluteus medius is it abducts the hip, and it prevents the adduction of the hip also, and it is the medial rotator of the thigh. So, gluteus medius is the abductor and it is the medial rotator of the thigh, and it originates from the it is situated below the gluteus maximus, and it is originated from the gluteal surface of the ilium and inserted to the greater trochanter of the femur. Nerve supply of the gluteal medius is superior gluteal nerve, whereas the gluteus maximus, it is inferior gluteal nerve. Next muscle is the next gluteal group muscle is the gluteus minimus, and it originates from the gluteal surface of the ilium under the gluteus medius muscle. So, gluteal surface of the ilium under the gluteus medius muscle, and it is inserted to the greater trochanter of the femur, from gluteal surface of the ilium to the greater trochanter of the femur. Again, its nerve supply is the superior gluteal nerve. The nerve supply is similar to that of the gluteus medius, and that is L4, L5, S1 nerve root, that is the nerve is superior gluteal nerve. It works in concert with the gluteal medius and for the abduction of the hip, and it is the medial rotator of the thigh. So, gluteus medius and gluteus minimus work together for the abduction of the hip and the medial rotation of the thigh, and it prevents the adduction of the hip. Now, next muscle is the tensor fascia lata. Tensor fascia lata is a small muscle which attaches inferiorly to the long thick strip of fascia known as IT band. So, tensor fascia lata is continues down as IT band or iliotibial band. Now, the origin of the tensor fascia lata is from the anterior iliac crest of the ilium, and is inserted to the lateral condyle of the tibia through IT band. Action of the muscle is flexion of the hip and abduction of the hip. So, tensor fascia lata, and it is tensor fascia lata continues inferiorly as IT band, and it originates from the inferior iliac crest and the ilium, and is inserted to the lateral condyle of the tibia through IT band. So, its action is flexion and abduction of the hip, and its nerve supply is from the superior gluteal nerve. Next important muscle on the buttock is the piriformis. Piriformis originates from the anterior surface of the lateral sacrum and is inserted to the greater trochanter of the femur. Action of the piriformis is it is the external rotator of the hip, and it is a hip abductor also. So, piriformis originate from the anterior surface of the lateral sacrum and inserted to the greater trochanter of the femur. Its action is, it is an external rotator of the hip and it is a hip abductor also. Nerve supply is from the branches of the brachial plexus. Next muscle is the obturator externus. Obturator externus originates from the obturator foramen and from the obturator membrane and is inserted to the medial aspect of the greater trochanter of the femur. Now, its nerve supply is from the posterior branch of the obturator nerve, that is L3 and L4, and its main action is, it is the adductor of the thigh and it rotates the thigh laterally. So, it is the lateral rotator and adductor of the thigh at the hip joint. So, obturator externus originate from the obturator foramen and obturator membrane and is attached to the greater trochanter, and posterior branch of the obturator nerve is the nerve supply and is the adductor and lateral rotator of the thigh. Next muscle of the buttocks region is the obturator internus. It starts its origin from the scioppubic ramus and obturator membrane, and it is attached to the medial aspect of the greater trochanter. And the nerve supply is nerve to the obturator internus, that is L5, S1 and S2 branches, and its main action is it abduct and rotate the lateral rotation and abduction of the thigh, and it is the stabilizer of the hip during walking. So, obturator internus, it abduct and lateral rotate the thigh, and it is the stabilizer of the hip during walking. Next muscle is the inferior gemellus. Inferior gemellus originate from the ischial tuberosity and it is attached to the obturator internus tendon. Now, the inferior gemellus, the nerve supply is nerve to quadratus femoris and it rotate it is a lateral rotator of the thigh. So, inferior gemellus start from the ischial tuberosity and attached to the obturator tendon, and the nerve supply is the nerve to quadratus femoris and it rotate laterally to the thigh. Lateral rotation of the thigh at the hip joint is the function of the inferior gemellus. Next muscle is the superior gemellus. It starts from the spine of the ischium and it is attached to the inferior obturator internus tendon, and it is nerve supply is from the sacral plexus, that is from the S1, S2 and S3. Superior gemellus, it rotates the lateral it is a lateral rotator of the thigh at the hip joint. So, superior gemellus starts from the spine of the ischium and attached to the obturator internus tendon, and its nerve supply is from the sacral plexus and it laterally rotates the thigh. Next muscle is in the buttocks region is the quadratus femoris. Quadratus femoris originate from the ischial tuberosity and it is attached to the intertrochanteric crust, and the nerve supply is nerve to quadratus femoris, and its main function is, its action is, it is a lateral rotator of the thigh. So, we were discussing about the muscles of the buttocks region. There are three gluteal muscles can be seen. These are gluteus maximus, gluteus medius and gluteus minimus. Then the other muscles in the buttocks region are tensor fascia lata, piriformis, obturator externus, obturator internus, inferior gemellus, superior gemellus, quadratus femoris. Now, we will be discussing about the muscles of in front of the thigh. Muscles of the in front of the thigh, especially these muscles are the hip flexors, and these are the main muscles of the hip flexors are iliopsoas muscle group. That is, iliopsoas muscle group consists of two muscles, that is iliacus and psoas major. There are accessory hip flexors. These are rectus femoris, sartorius and pectineus. The iliopsoas is the chief hip flexor. So, it is seen on the anterior side of the thigh and it consists of two muscles, iliacus and psoas major. So, iliacus it's originated from the iliac fossa and is inserted to the lesser trochanter, and its action is flexion and lateral rotation of the thigh at the hip joint. And the second action is it fluxes the trunk and the pelvis over the thigh, and the nerve supply is from the femoral nerve. So, iliacus muscle is originated from the iliac fossa and it is inserted to the lesser trochanter of the femur, and its action is flexion and lateral rotation of the thigh and flexion of the trunk if the pelvis is over the thigh. So, these are the chief fluxes of the hip joint, and its nerve supply is from the femoral nerve. Next part of the iliopsoas group is the psoas major muscle. It is a long fusiform muscle located on the side of the thoracic region of the vertebral column and brim of the lesser pelvis. It joins the iliacus muscle and forms the iliopsoas muscle group. So, psoas muscle, it originates from the transverse process of the T12 to L5 and the lateral aspect of the disc between them. So, inserted into the lesser trochanter of the femur, and its action is it fluxes and laterally rotate the thigh. These are the chief fluxes of the thigh at the hip region, and it laterally rotate the thigh. And nerve supply is from the lumbar flexus, that is through the anterior branches of L1 to L3 nerve. Another muscle which is seen on the anterior side of the thigh is the quadriceps muscle. The main function of the quadriceps muscle is the extension of the knee joint. Along with that, one of the quadriceps muscle, rectus femoris, helps in the flexion of the hip joint, because this muscle rectus femoris is a two joint muscle. It's having action at both it's having action at the knee joint and the hip joint. So, the quadriceps muscle group consists of four muscles. These are seen on the anterior side of the thigh, and it include rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. So, it consists of four muscles. The rectus femoris, by the name itself we can understand that it contains four muscles, that is rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. So, rectus femoris and vastus intermedius, it's exactly seen at the center, and vastus medialis is on the medial side and vastus lateralis on the lateral side. Vastus medialis is having two parts, a vastus medialis obliquus and vastus medialis longitudinal. So, vastus medialis obliquus and longitudinal, it pulls the patella medial side. At the same time, vastus lateralis pulls the patella on lateral side, and we will get a posterior pull. The net pull will be a posterior pull which stabilizes the patella on the femur. Now, the quadriceps muscle consists of four muscles, that is rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. Rectus femoris is the one of the four quadriceps muscle, and its origin is from the anterior inferior iliac spine. It starts from the anterior inferior iliac spine and it inserted to the patella. So, it is inserted to the patellar tendon as one of the four quadriceps tendon. So, all these quadriceps muscle and it makes a common tendon called quadriceps tendon to the patella. From the patella it goes down, it attached to the patella, and from the patella there is another tendon called patellar tendon, and it is attached, then it attached to the tibia or the tibial tuberosity. Now, origin of the rectus femoris is from the anterior inferior iliac spine, and it is inserted to the patellar tendon as one of the four quadriceps muscle. So, we already discussed its action. Its action is knee extension and along with that hip flexion, because it is having action at the hip joint also, because it is a two joint muscle. So, its action, the rectus femoris act, these are the chief knee extensors. Along with that knee extension, it flexes the hip joint also. Nerve supply to the rectus femoris is from the femoral nerve. Vastus lateralis is a one joint muscle, and it's also included in the quadriceps group, and its origin is from the greater trochanter and intertrochanteric line and linea aspera of the femur. So, its originate from the greater trochanter, intertrochanteric line and linea aspera of the femur. Now, it is attached to the patella and tibial tuberosity. First of all, it makes a common tendon called quadriceps tendon, and attached to the patella from the patella it makes another tendon called patellar ligament or ligamentum patellae or patellar tendon, and it attached to the tibial tuberosity. The nerve supply of the vastus lateralis, again it is a femoral nerve, and its main action is extension of the knee and stabilization of the knee. So, vastus lateralis is the muscle which extend another quadriceps muscle which helps which work together along with the other quadriceps muscle and extend the knee. Another important muscle in the thigh region which is seen in the thigh region is the sartorius muscle. Sartorius muscle is the one of the longest, it is the longest muscle of the body. It is also known as Taylor's muscle, and it's a long thin muscle that runs down the entire length of the thigh. So, sartorius originate from inferior to the anterior superior iliac spine, and it is inserted to the anteromedial surface of the upper tibia in the pes anserinus. Its action is flexion, abduction and lateral rotation of the hip and flexion of the knee. So, action of the sartorius is flexion, abduction and lateral rotation of the hip and flexion of the knee. Nerve supply of the sartorius, again it is the femoral nerve. So, sartorius, its action is flexion, abduction and lateral rotation of the hip and flexion of the knee. Now, the hip extensors, we already discussed both extensors. These are the gluteus maximus. We already discussed one extensor. The chief extensor of the hip is gluteus maximus, and another extensor is the hamstring muscle. Gluteus maximus, we already discussed about the gluteus maximus muscle group. Then hamstring, we will be discussing it later. Then there are some muscles which causes hip abduction. Hip abductors are gluteus medius and gluteus minimus. We already discussed about its origin and insertion, and there are accessory muscle which causes hip abduction. These are tensor fascia lata and sartorius. So, this muscle also we already discussed. Now, hip adductors. There are three muscles are there which causes adduction of the hip. The hip adductors are adductor longus, adductor brevis and adductor magnus, and there are accessory muscles which adduct the hip. These are pectineus and gracilis. So, the first muscle is the adductor longus. Adductor longus origin from the superior pubic ramus just below the crest. So, origin of the adductor longus is from the superior pubic ramus just below the crest. Now, the adductor longus inserted to the linea aspera, middle third of the linea aspera of the femur, the adductor longus is inserted. So, we know as the name itself, these are the muscle, this is the muscle which causes the adduction of the hip, and it also helps in hip flexion. Nerve supply, the adductor group, the adductor longus is supplied by the obturator nerve. Second muscle of the adductor group is the adductor brevis. Adductor brevis, it originates from the pubic bone and it is inserted to the upper part of the femur. Now, action of the adductor brevis is, these are the hip adductors, and this also helps in hip flexion. Nerve supply, again the adductor brevis also supplied by the obturator nerve. Next muscle in the adductor group is the adductor magnus. Adductor magnus is the largest adductor group muscle, and its origin it's having two heads, an adductor head and hamstring head. Adductor head start from the inferior ramus of the pubis and ischial ramus, and hamstring head starts from the ischial tuberosity. So, adductor magnus is the largest among the adductor group of muscles. Adductor it's having two origins, that is an adductor head and an hamstring head. Adductor head is from the inferior ramus of the pubis and ischial ramus, and the hamstring head originates from the ischial tuberosity. Now the insertion. Adductor head is inserted at the gluteal tuberosity, linea aspera and proximal supracondylar line. So adductor head, again it is insertion also like making two heads, an adductor head and an hamstring head. Adductor head is inserted to the gluteal tuberosity, linea aspera and proximal supracondylar line. Hamstring head it's inserted to the adductor tubercle of the femur. Action of the adductor ramus, all of us know that the same work adductor, as the name itself we can understand, it is the adductor magnus is the adduction is the work is action is the adductor adducts the hip joint, along with that it helps in flexion of the hip. So again the depends upon the head, its action is also different, both adduct and along with that adductor head flexes the hip and hamstring head extends the hip. So adductor head along with the adduction it flexes adductor along with the adduction it does the flexion of the hip. Adductor head does the flexion of the hip, and at the same time hamstring head extends the hip. Nerve supply of this adductor group is from adductor head from the obturator nerve and hamstring head from the sciatic nerve. So nerve supply of the adductor magnus and it is from adductor head is supplied by obturator nerve and hamstring head is supplied by the sciatic nerve. Now the medial rotators we already discussed about these muscles. The medial rotator muscles are tensor fascia lata, anterior fibers of the gluteus medius and minimus, and lateral rotators are obturator, gemellae, quadratus femoris and piriformis. Now the muscles of the posterior region of the thigh, the main muscles of the posterior region of the thigh is the hamstring muscles. It is located at the posterior compartment of the thigh. Hamstring muscle consists of three muscles. These are semitendinous, semimembranosus and biceps femoris. Hamstring muscle group consists of three muscles: semimembranosus, semitendinosus and biceps femoris. Biceps femoris, the first muscle among the hamstring muscle group is the biceps femoris, and it originates from the tuberosity of the ischium, linea aspera and femur, and it is inserted to the head of the fibula, which articulate with the back of the lateral tibial condyle. So biceps femoris originate from the tuberosity of the ischium, linea aspera and femur, and it is inserted to the head of the fibula. Now it's having two head, a long head and a short head. Long head is nerve supply to the long head is from the tibial nerve, and nerve supply to the short head from the common peroneal nerve. So the main function of all hamstring muscles are the primary flexors of the knee joint, and these are the flexors of the knee joint. So biceps femoris, it flexes the knee joint, along with that it laterally rotates the knee joint. It also long head of the biceps helps in extension of the hip joint. So biceps femoris, it's having two heads, a long head and short head. Long head is supplied by the tibial nerve and short head is supplied by the common peroneal nerve, and these are the flexors of the knee joint. Along with the flexion of the knee joint, this biceps femoris laterally rotate the knee joint, and the long head of the biceps femoris helps in extension of the hip joint. So it's originate from the biceps femoris, originate from the tuberosity of the ischium, linea aspera and femur, and it is attached to the head of the fibula. Next muscle in the hamstring muscle group is the semitendinosus. Semitendinosus originate from the tuberosity of the ischium, and it is attached or it is inserted to the pes anserinus, and its nerve supply is from the sciatic nerve, that is sciatic nerve, and its main action is again the flexion of the knee, and it extends the hip joint also. So, the semitendinosus, its origin from the tuberosity of the ischium and is attached to the pes anserinus, and these are the nerve supply is the sciatic nerve, and its main function is the flexion of the knee. It helps in extension of the hip joint also. Next muscle in the hamstring muscle group is the semimembranosus. Semimembranosus, it originates from the ischial tuberosity, and it is inserted to the medial surface of the tibia, and its nerve supply is from the sciatic nerve, and its action is again knee flexion. Along with the knee flexion, it helps in hip extension. So, semimembranosus, semitendinosus and biceps femoris together makes the hamstring muscle group, and hamstring muscle group, the nerve supply is mainly from the sciatic nerve, and the biceps, among this biceps femoris is supplied, long head is supplied by the tibial nerve, and short head is supplied by the common peroneal nerve, and the hamstring muscle group include the biceps femoris, semitendinosus and semimembranosus. These are the chief flexors of the knee joint. Along with that, this helps in knee extension also. Now we will be discussing about the muscles of the leg. The leg muscles can be divided into different compartments. There is an anterior compartment, there is a posterior compartment, and there is a lateral compartment of the muscle which contain the fibularis muscle or peroneal muscles, peroneus muscle. Now, the posterior compartment muscle include the gastrocnemius, soleus, plantaris, popliteus, flexor hallucis longus, flexor digitorum longus and tibialis posterior. Now, we will go through the original insertion of different muscles. The gastrocnemius muscle, its origin is from the femur itself, and it's a gastrocnemius muscle is a two joint muscle, and its origin originate from the femur itself, and it is attached to the calcaneum. It is inserted to the calcaneum, and gastrocnemius muscle is supplied by the tibial nerve. It is a part of it is from the sciatic nerve itself. Superficial, that is nerve root is S1 and S2. The function of the gastrocnemius muscle, action of the gastrocnemius muscle is the plantar flexion, and it helps in flexion of the knee also. So, gastrocnemius muscle is the muscle which starts, it is a two joint muscle starting from the femur, attached to the calcaneum, supplied by the tibial nerve, and its action is, these are the chief plantar flexor, is one of the important plantar flexor of the foot. Now, soleus muscle starts from the fibula, that is, and from the medial border of the tibia. So, soleus muscle origin from the medial border of the tibia and from the fibula also, and it makes a common tendon with the gastrocnemius muscle and makes the tendocalcaneus tendon, tendocalcaneus, and or it makes the Achilles tendon and attached to the, and it's inserted to the calcaneum. And soleus is a muscle which helps in plantar flexion along with the gastrocnemius. Next muscle is the plantaris muscle. Plantaris muscle is originate from the lateral supracondylar ridge of the femur above the lateral head of the gastrocnemius, and it's inserted to the tendocalcaneus again, and its nerve supply is the tibial nerve, and its action is plantar flexion of the foot. Next muscle is the popliteus muscle. It is originate from the middle facet of the medial surface of the lateral femoral condyle, and it is attached to the posterior tibia under the tibial condyle, and the nerve supply is the tibial nerve, and its function is the medial rotation and flexion of the knee. flexor hallucis longus. It is attached to it is originate from the fibula, that is posterior aspect of the upper 1/3 of the fibula. Origin of the flexor hallucis longus is the posterior 1/3 of the posterior aspect of the upper 1/3 of the fibula, and is come down and it is attached to the base of the distal phalanx of the hallux. And the nerve supply is the tibial nerve, that is S1 and S2 nerve root, and its action is it flexes all joint of the hallux and plantar flexion of the angle joint. So, this is the flexor hallucis longus. Next muscle is the flexor digitorum longus. Flexor digitorum longus, it starts from the medial side of the tibia, that is its origin is from the medial side of the tibia, and it is attached to the distal phalanx of the all 4 digits, and the nerve supply, again the tibial nerve supplies to this muscle, and its primary action is flexion of the digits. Another muscle is the tibialis posterior muscle. Tibialis posterior muscle, it starts from the fibula and tibia, and it is attached to the navicular and medial cuneiform bones, and these are the tarsal bones, and the nerve supply is the tibial nerve. Its action of the tibialis posterior muscle is the inversion of the foot. It helps in plantar flexion of the foot at the ankle joint. So, tibialis posterior muscle starts from the tibia and fibula, and it is attached to the navicular and medial cuneiform bone, and the nerve is the tibial nerve. It helps in inversion of the foot and plantar flexion of the foot at the ankle. Now, the peroneal muscle, these are the lateral compartment muscles. The muscles include the peroneus longus and peroneus brevis. So, lateral compartment muscles are called peroneus muscle or fibularis muscle. It includes 2 muscles, peroneus longus and peroneus muscle brevis. Now, the muscles of the foot. In the dorsal aspect of the foot, there is extensor digitorum brevis is there. It starts from the calcaneum and is attached to the toes, and the nerve supply is the deep peroneal nerve, and its main action is it extends the digit of 2, 3rd, 2nd, 3rd and 4th digit. Extension of the 2nd, 3rd and 4th digit is the action of the extensor digitorum brevis. Next muscle is the extensor hallucis brevis. Extensor hallucis brevis starts from the calcaneum, and it is attached to the base of the proximal phalanx of the hallux, and the nerve supply is the deep peroneal nerve, and the action is extension of the hallux. Then there are some intrinsic muscle on the plantar aspect of the foot. It is divided into different layers. There are 4 layers can be seen at the foot, the plantar aspect. These are superficial layer, there is a middle layer, there is a deep layer, and there is an interosseous layer. So, the superficial layer consists of 3 muscles. These are abductor hallucis, abductor digiti minimi and flexor digitorum brevis. So, there is a superficial layer which consists of abductor hallucis, abductor digiti minimi and flexor digitorum brevis. The second layer is the middle layer. This is the quadratus. This consists of 2 muscles. These are quadratus plantae and lumbricals. So, middle layer consists of quadratus plantae and lumbricals. And the third layer is the deep layer. It consists of 3 muscles again, and it includes the flexor hallucis brevis, adductor hallucis and flexor digiti minimi. Adductor hallucis is having 2 heads, a transverse head and an oblique head. And there is an interosseous layer. Interosseous layer consists of 2 interosseous muscles. These are plantar interosseae and dorsal interosseae. So, the superficial muscle, the muscles of the foot can be divided into 4 layers. It is arranged in 4 layers. The layers are the superficial layer, middle layer, deep layer and an interosseous layer. superficial layer consists of three muscles. These are abductor hallucis, abductor digiti minimi, and flexor digitorum brevis. The middle layer consists of quadratus plantae, lumbricals. The deep layer consists of flexor hallucis brevis, abductor hallucis, abductor hallucis, and flexor digiti minimi. And the interosseous layer consists of plantar interossei and dorsal interossei. These are the muscles. These are the intrinsic muscles of the foot. Thank you. In this session, we will be discussing about the fatigue and overtraining. All of us know once after doing a lots of activities, we get fatigued. Whatever the exercise or whatever the activity we does, we get fatigued. Fatigue can be defined as a general sensation of tiredness and accompanying decrease or decrement in the muscular performance. So this is the definition of fatigue, is the general sensation of tiredness and accompanying decrease or decrement in the muscular performance. The causes of the fatigue, it may be due to effect on the energy system. It may be due to accumulation of metabolic byproducts of like lactic acid. It may be due to an influence of the nervous system, or it may be due to a failure of the muscle fibers contractile mechanism. The causes can be, there are 4 different types of causes. Causes which is related to energy system, causes due to the accumulation of waste products, causes which is related to the nervous system, and causes due to the failure of muscle fibers and contractile mechanism. Although lack of availability of energy can reduce the muscle's capacity to generate force, energy systems are not fully responsible for all forms of fatigue. And we'll go through the first cause, that is energy system and fatigue. The causes for fatigue in the energy system may be a PCR, a creatinine phosphate depletion, or a glycogen depletion. The first one is PCR depletion. Once we discussed about the energy system, there are lots of compounds. There are 3 types of energy system. The first one is an immediate system where the creatinine phosphate is used. Creatinine phosphate is used usually uses for the rebuild of high energy ATP. So PCR is used under anaerobic condition to rebuild high energy of ATP. Now, once we are using this PCR a long time, this PCR get depleted, and this has to be replaced fast. So once this PCR is getting depleted, ability to quickly replace ATP is seriously hindered, and the person may get fatigued. Second cause in the energy system, cause of energy system and fatigue, is the glycogen depletion. After this PCR, the second system is the glycogen system, that is lactic acid system and aerobic system. In both the systems, we use the glycogen as the source of energy. Glycolysis is the action, but in this case, in the lactic system, there is anaerobic glycolysis is there, but in the lactic acid, but in the aerobic system, there is aerobic glycolysis is there. In both the cases, we use glycogen as the source of energy. So what is happening is that muscle ATP levels are maintained by both aerobic and anaerobic breakdown of glycogen. That is, glycolysis an important method. So in aerobic and in both aerobic and anaerobic system, that is in the lactic acid system and aerobic system, we uses glycogen as the source of energy, that is glycogen as the source of the production of ATP. So this glycogen level has to be maintained. So if the glycogen, in both cases, if the glycogen reserves anyway, unfortunately the glycogen reserves are limited and get depleted quickly, and once the glycogen storage is depleted, there is chance of fatigue. So even in the events lasting for longer than few seconds, glycogen become the primary energy source for ATP synthesis. So once we go through the energy systems, which energy systems and fatigue, there are two things we have to take care. The first thing is that a decrease in the PCR depletion. For if the bout is for about a less duration, a PCR depletion may cause fatigue, and if a glycogen depletion, if it is lasting for more than few seconds, a glycogen depletion causes a glycogen reserves depletion causes the fatigue. Next cause of fatigue is the metabolic byproducts accumulation and fatigue. So we studied different systems. In this system, there is a system called energy system. There is a system called a lactic acid system. In the lactic acid system, the byproduct of lactic acid system or anaerobic glycolysis is lactic acid itself. Now this lactic acid has to be removed from the body, or when it is not cleared, the lactic acid dissociate, converting lactate and causing accumulation of hydrogen ions. So this lactic acid causes accumulation of hydrogen ion. Once there is accumulation of hydrogen ion, the muscle acidification occurs, that is the pH become low. So there is a optimal pH for all the work in the body. An intracellular pH is, if it is around 6.9 to 7, and if the intracellular pH is below 6.9, there will be lots of issues, like it inhibits the action of phosphofructokinase, an important glycolytic enzyme. It is an important glycolytic enzyme slowing the rate of glycolysis and ATP production. So once there is lactic acid production is there, lactic acid accumulation is there, it causes the accumulation of hydrogen ions. This hydrogen ion, presence of this hydrogen ion causes acidification of the muscles. So the pH may become slow. Once the pH becomes low, it inhibits the action because enzymes has to work in an optimal pH. If the pH becomes low, and if that is it become acidic pH, the action of phosphofructokinase will affect. So this phosphofructokinase is an important enzyme, glycolytic enzyme, which helps in glycolysis, and once there is action of phosphofructokinase decreases, it causes it slow the rate of glycolysis and slow the rate of ATP production, and the person may get fatigued. At the pH of 6.4, the influence of hydrogen ion stops any further glycogen breakdown, causing a rapid decrease in ATP, and ultimately the person get exhausted. Then in addition to hydrogen ion may displace calcium, hydrogen ion may displace the calcium in the fiber, interfering the coupling action of actin and myosin cross bridges and decrease the muscular contraction forces. So a low pH is the major limiter of performance and primary cause of fatigue, causing the maximal all-out exercise lasting more than 20 to 30 seconds. So we'll revise in the what is happening in the how the metabolic byproducts causes fatigue. An exercise which is lasting more than few seconds, the energy system used is the lactic acid system or anaerobic glycolytic system. So, one of the byproduct of anaerobic glycolysis system, the main byproduct of anaerobic glycolysis is the lactic acid. Lactic acid accumulation of in the body causes accumulation of lactic acid is not cleared, it dissociates and there is accumulation of hydrogen ion. So, the accumulation of hydrogen ion causes causes a decrease in the pH, causing an acidosis and muscle acidification. Now, once there is an acidosis or muscle acidification, it causes a decrease in the pH level. There will be an optimal pH level where all the enzymes work. As there is acidification, the pH will come down and it will inhibit the action of phosphofructokinase. Phosphofructokinase is an important enzyme, glycolytic enzyme, which helps in glycolysis and ATP production. Once there is effect in the if it inhibit the action of phosphofructokinase, so it will affect the glycolysis and ATP production. If there is more accumulation of hydrogen ion, the pH again comes down. The pH again comes down and it stops further glycolysis and the body completely goes into an exhaustion. Now, another negative demerits or another negative thing happening is that the hydrogen ion may replace calcium ion in the muscle fiber. So, once hydrogen ion replaces the calcium ion, the actin-myosin coupling and cross bridges may get affected and it also will affect the muscular contraction forces, and all these decreases the performance and it causes fatigue of the body. Next theory which is postulated for fatigue is the neuromuscular fatigue or neuromuscular theory. According to this theory, fatigue is a result of inability to activate muscle fiber. That is, as the impulse, we know that how the activation of muscle fiber occurs. As the nerve impulse is transmitted through the neuromuscular junction, it activates the fiber membrane and it causes the fiber sarcoplasmic reticulum to release the calcium. The calcium binds with the troponin to produce the muscle contraction. Now, there are two mechanisms has been postulated in this theory, in the neuromuscular fatigue. The first one, that is, the fatigue may be caused by, the fatigue may occur at the neuromuscular junction, preventing the nerve impulse. That is, there are two mechanisms has been postulated under neuromuscular fatigue. The first one is the fatigue which caused by a prevention of the neural transmission, and there is another fatigue which is caused by the central nervous system. The fatigue which causes neural transmission, there are one or more processes may be involved. That is, fatigue may occur at the neuromuscular junction, preventing the nerve impulse transmission to the muscle fiber. Here in there are two types of mechanism may occur. The first one is a release or synthesis of acetylcholine may reduce. So, this causes prevention of neural transmission. Next is, there is an enzyme called choleisterinase. Choleisterinase, it is an enzyme which break down acetylcholine. Now, once this enzyme once it is relayed impulses from, once it relates, the impulses become hyperactive, preventing sufficient contraction of acetylcholine to initiate the action potential. So, higher threshold of muscle fiber membrane occurs, and combinations of some other substances with acetylcholine with receptors of the muscle membrane without activating the membrane, and potassium might leave the intercellular space, decreasing the membrane potential to half of the resting value. So, this is the fatigue which is caused by, preventing it is occurs by prevention of the impulses through neuromuscular junction. And there is another cause of fatigue postulated, that it is postulated that CNS, once the person done an excessive work, the central nervous system percept the muscle have done an excessive work. So, it does a protective mechanism by itself and the muscles goes into fatigue. So, we were discussing about the fatigue, and there are 4 theories have been postulated regarding the fatigue. The first theory is regarding the energy system. According to this theory, there is the supplies, that is like PCR, the creatine phosphate, which is an important part of the immediate system or immediate system, ATP PCR system. The PCR get depleted, the person may get fatigued. And second one is glycogen depletion, that is a glycogen, it's an important part of the aerobic and anaerobic system, that is lactic acid system, may get depleted and the person will get and the person won't get enough ATP and he may get fatigued. The second theory postulated is the metabolic byproducts, that is accumulation of metabolic byproducts, that is especially seen in the lactic acid system, that is anaerobic glycolysis. In this there is production, there is accumulation of lactate and hydrogen ions, which causes the decrease in the pH level, which inhibit the action of phosphofructokinase, and it will negatively affect the glycolysis and production of ATP. And it also the produced hydrogen ion may replace calcium, and it causes hindrance to the muscular contraction forces and reaches the fatigue. Once we go through the neuromuscular fatigue, one type of fatigue caused, another cause is postulated is that the transmission of impulses through the neuromuscular junction may get blocked, mainly by the 2 mechanism has been postulated under this. The first one is a release or synthesis of acetylcholine may reduced, and the second mechanism postulated is that an enzyme which break down the acetylcholine may release, that is acetylcholinesterase. And there is a mechanism, another mechanism for fatigue is the central nervous system mechanism, that is it is controlled by central nervous system. The central nervous system can understand how much the person worked, and regarding the muscular fatigue, and so CNS itself make a protective mechanism and the person will get fatigued by himself, fatigued. So, we were discussing about the fatigue and overtraining syndrome, overtraining. Now, once we are giving lots of training, once we are giving doing lots of exercise, your muscle may get fatigued. And excessive training, if you keep on doing the excessive training procedure, so we are giving the regular training procedure for conditioning, to improve the conditioning, to improve the strength level, to improve the flexibility level, etc. Now, if we are giving more training, it may reach to fatigue, then overreaching, and later it leads to a condition called overtraining syndrome. It is an excessive training procedures. With an excessive training procedures, there won't be any improvement in conditioning or performance. And this can lead to a chronic state of fatigue that is associated with muscle glycogen depletion. So, and this condition is known as overtraining or overtraining syndrome. So, usually if you are doing a training for a long period of time, the muscle may get fatigued. But after a period of rest and proper nutrition, and after a period of rest, the muscle can come back to its normal state. But if overtraining is a state Where the muscle undergo, the muscle will go to a chronic state of fatigue. So, overtraining we can call it as it's a chronic fatigue.